Welcome, everybody, once again to Pierre Toussaint's National Diabetes Awareness Month celebration and conversation. Up next, we have Shivani Mohabir. She is the Director of Clinical Nutrition and a registered dietitian. Shivani, thank you so much for joining us today.
Thank you for having me.
Awesome. It's such a pleasure to have a nutritionist, or dietitian rather, here to have a conversation surrounding diabetes.
Yes.
All right. So Shivani, tell me a little bit about what you do and why is having a dietitian so important as a part of a patient's care?
So being a registered dietitian, I mean, we're all food experts, but being a registered dietitian, we take the science of research behind food and our application in the medical world, and we focus it towards our intervention in disease processes or comorbidities where we may have. In terms of diabetes, our goal really is to not give up the foods that we love, but really to find a way to incorporate the flavors that we love while getting those nutrients, both macro and micro, that we need to manage our diabetes. So that's really, we have one-on-one sessions. A lot of our patients, residents are very individualized on their meals and what they like to consume. So we tailor nutrition intervention so we can manage the diabetes without giving up the foods that they love with medical nutrition therapy.
That's amazing. Thank you so much for shedding light on that. I don't think a lot of patients know that there's actually a nutrition program that they can come to and they have one-on-one counseling with a nutritionist or a dietitian such as yourself. I think that is super helpful, and it's great because unlike the other programs that exist out there where you have to pay, this is basically covered by your health insurance.
Yes.
So that's awesome. So if somebody would like to perhaps schedule an appointment to come see you or somebody from your team, what's the best way that they can do that?
So the best way to do that is right here at Pierre Toussaint, we have an excellent diabetes program with Dr. Kudroff. I work very closely with him. What the process is normally, he sees our patients and clients first, and then if the need for nutrition is there, even for preventative care, it's always important if we can prevent it from happening, then we're involved, is to speak with Dr. Kudroff, let him know that I would like to see a dietitian. I would like for someone to help guide me in the types of food I like, the variety. And really, our staff here, they're very great in coordinating care. So
awesome. Yeah. So they don't have to be necessarily diabetic to see a nutritionist or a dietitian.
Correct.
Okay, that's awesome to know. So you heard it. So now let's talk. Holidays are coming.
Yes.
Thanksgiving is coming. Christmas is coming. New Year's is coming. All I hear is food, food, food. So tell me a little bit about what are your tips, what are your tricks for someone like me, for example, who loves to cook, okay? I consider myself a food expert too. Just give me a turkey, you see what I could do with it. So, what are some tips and tricks that you have for your patients or for everyone watching today of how can they still have an excellent meal that's balanced? Because I'm sure in this community we're Caribbean, West Indian, and I mean, it's so mixed, right? But there's a lot of carbs involved.
Yes.
And I know my family, Thanksgiving, it's not looking half a vegetable that it's supposed to be looking like. It's usually half rice, half macaroni, lasagna, carbs. You get the point? Okay. So, so what are some tips you have for us? You know, please share because, you know, I really want everybody to know, like, you still can enjoy your Thanksgiving, I hope.
Yes.
And still have some good food, but still have your plate also looking right. So you're not paying the cost later.
Yeah. So normally between Thanksgiving and Christmas is when we tend to gain the most weight, when we tend to indulge in the foods that we love. Really some small tips. The good news is turkey is a lean protein, so that's really good. It's what we tell our clients is to make sure that you're focused more on the lean proteins on your plate. So turkey, fishes, chicken. If you're going to make your turkey, make sure you bake it instead of deep frying it.
Kind of wanted to try that. I'm not lying. But I won't.
Of course, everything that you're having in Thanksgiving, it's so delicious. Our families make a really good meal. Is to really have it in moderation. Really look at what's on your plate and say, okay, really, do I need to eat 2 slices of mac and cheese? Like, it's really portion control and moderation. Looking at those low-fat items instead of having, maybe when you're having your salad, having like instead of having a ranch dressing, maybe have a low-fat salad, something that's less on the fatty side. The oils that you cook in too. If you have an option, then definitely gear towards olive oil, canola oil. They're better than other lard. I know some in our West Indian community, we cook with a lot of lard and fatty substances too. But really, it's moderation. It's really key there. Is enjoying Thanksgiving, having a little bit of everything that's on the plate, but in moderation is really what we aim for. And then everyone asks, then what's moderation? Moderation is when your body tells you, okay, I'm full now. Maybe I shouldn't go for the seconds or third. Maybe I should get up a little bit after I'm finished eating my Thanksgiving dinner and walking about. Really, exercise and being active really also plays a tremendous part in what we eat and how we maintain our body and lifestyle. And just having that circulation of blood flow really helps to digest our food better. And
that's a good thing that you mentioned, because we sometimes for Thanksgiving, we tend to eat late because everybody's prepping the turkey, the ham, the this and the that. And by the time you get on the table, either you're so full because of the smell from the food and all this, the back and forth going on, and we end up eating so late. So I think something I know my family's doing this year, we're trying to eat early so we could actually get up, walk around, have some fun, play some games, stay active. And then if, later on we could actually have dinner, however that goes, like a second part where we're not like staggered at 9 p.m. Everybody's like hovering over, then you're just sitting there, you're so heavy and
you don't want to move.
And you don't want to move.
Yes.
So that's a great tip. And like you said, a lot of fruits, a lot of salads. I mean, everybody thinks it's Thanksgiving, and I know the turkey's the star, but we can have some vegetables too, right?
No.
We should be.
And we have really good vegetable, all our green beans, string beans. They're high in fiber, and really fiber helps us be full faster, especially with diabetic residents too. We encourage a lot of fibrous foods. So even things like apple and pears, I know we have them a lot. We make apple pie. We make all the pies in the Thanksgiving. Really.
Smothered in butter, though.
Well,
and sugar.
Yes. I mean, but that comes back to what I said. Moderation is really key to
absolutely.
it. Yeah.
Thank you so much for sharing those tips. It's amazing. I'm sure everybody watching here today is excited to just look at what they're going to be cooking and making, and not get discouraged from cooking, but cooking smarter.
Yes.
Including me. So thank you so much once again. Thank you. Thank you for coming.